is going to be about PNF technique. We all know that PNF is proprioceptive neuromuscular facilitation. This proprioceptive means including your sensory receptors, which will tell you your joint position and the movement that you're going to do. Now this neuromuscular means including your nerves and the muscles required for the movement. Now this facilitation means to make something easier. That is, in your terms, it is to make a movement easier. So this is all about proprioceptive neuromuscular facilitation. Now this is nothing but an exercise which is based on the principles of the functional anatomy and neurophysiology. The functional anatomy is nothing but for your functional movements, for your functional activities. Say for combing a hair, you will know what kind of movement is required at the shoulder joint, at your elbow joint, at your wrist, etc. So there is a flexion at my shoulder joint, there is an elbow flexion at the elbow joint, there is a slight extension at my wrist joint and finger flexion. So this is all required for the combing position. So this is termed as functional anatomy. In this PNF technique, there are few important things like the proprioceptive part, which gives the proprioceptive feedback, and the auditory input that you give to the patient. When he listens to your command and performs a movement, the functional outcome, that is the functional motor activity required, will be brought out. So it can be in cases of neurological rehabilitation or in cases of sports rehabilitation, you can use this PNF technique. Now this PNF technique has a neurophysiological basis, which includes the facilitation part, the inhibition part, the stretch reflex and the neurophysiological phenomena of that. Now this facilitation includes nothing but the recruitment of more number of motor neurons from the spinal cord so that the muscle's excitability capacity increases. That is, in a weak muscle, when the muscle is not able to recruit more number of motor neurons to perform an activity, this facilitation technique will help in recruiting more number of motor neurons, so you receive more impulses and the movement is completed. Going to the inhibition technique. Inhibition technique is carried out in muscles which are hyperexcited. That is, in case of spasticity, you will have to reduce the activity of the muscle. The hyperactive muscle in cases of spasticity will require this inhibition technique. Now the next thing that we are going to look into is the stretch reflex. Stretch reflex is nothing but the myotatic reflex, which means this reflex occurs from the muscle. So this includes two things. One is the muscle spindle, the other one is the Golgi tendon organ. These two things are responsible for producing the stretch reflex in a muscle. So now this neurophysiological phenomena involves autogenic inhibition and reciprocal inhibition. This autogenic inhibition is nothing but when you try to contract an agonist muscle. Say if I try to contract my elbow in flexion, what happens is my agonist is my biceps, it is contracting. When I contract this and relax, what happens is relaxation occurs at my agonist itself. This is autogenic inhibition. Now the reciprocal inhibition is nothing but when I contract this biceps, this is the agonist. Now the antagonist of this movement, my triceps, will be relaxed. This is called reciprocal inhibition. So in weeks to come, let us see in detail what is autogenic inhibition and what is reciprocal inhibition in detail. And as a series of PNF, we will be seeing about the principles of PNF, the uses in weeks to come. Thank you.